Welcome to the Flex Forward podcast, where grit meets growth. With your host, Nick Espinette, bringing you stories of resilience, reinvention, and the real climb to success.
Hello, everyone. Welcome to the Flex Forward podcast. Today, we're joined by Amy Urban. Amy is a dentist, but she's also a CEO and founder of several businesses, including Harmony Appliance, Straw Air, dental sleep medicine, and urban dentistry. Sound like she's got a lot going on, and I'm excited to learn from her today. Amy, can you tell our listeners a little more about you? Well, first of all, welcome to the Flex Forward podcast. Glad to have you. Can't wait for our listeners to learn more about you, what it is you do. Can you share with our listeners kind of what you do at each one of your different companies and just a little bit about you?
Yes. Hi, Nick. Thanks so much for having me. I'm Amy Urban. I live in Austin, Texas. And by profession, I am a dentist, founder of Harmony Appliance and Estra Air. And I opened my dental practice in 2003. And in the past 10 years, my focus has really been on dental sleep medicine, as Nick had mentioned. And what this means, because a lot of people probably go to the dentist and they are not aware that that was even something that dentists did. And so basically, dentists have the unique ability to have perfect access, visual access to see their patients' airways. And so this is part of a movement to get more providers, more specialists involved in screening for sleep apnea. And so that is where I've been spending my focus in the past 10 years. And I was amazed by how many patients had narrow airways and were having problems functioning, and their quality of life wasn't very good because they were so tired. And I would say greater than 60% of my patients.
Oh, wow.
So it was really eye-opening. So after the dentist does a screening and says, yep, I can't see your airway, we send him to a sleep physician to do a sleep study. And then we get him back, and patients that have mild cases, dentists can make a little mouth appliance for patients. And for everybody else, they get a CPAP, which is the gold standard of treatment. Mm-hmm. Because I had so many patients on CPAP machines, I got to hear all of their discussions, gripes, complaints about their machines. And really the biggest thing was side effects with their mouths falling open, getting woken up, not being able to fall asleep. And this is why I developed the Harmony Appliance, which is the first device that actually keeps the mouth closed from inside the mouth. And this is one of those areas in medicine that I was surprised that nobody had thought of this before. Patients were using headbands to keep their mouths closed, which seems like such an archaic, antiquated system.
I think it was old-fashioned, like the old movies where when they saw the dentist, they tied a bandana around their jaw.
Exactly, and that's what they're doing, and that's what sleep doctors are prescribing for their patients. So I had this neat, developed a Harmony Appliance, a neat way to keep the patient's mouth closed. And I've been working on that for the past few years. And something else really came into my radar, which was that I noticed from studies as well as in my personal experience and practice that women perimenopausal in that area, postmenopausal, were almost doubling in sleep apnea cases as far as new onset. And in some cases worsening. And that's a big deal. And usually you think of big guys overweight men having sleep apnea. Mm-hmm. That's what we think of as a typical prototype. And so I've been delving into that, and urogenital cases, basically vaginal tissues in particular, are treated with localized estrogen. And it's a very effective way to minimize systemic absorption of estrogen, which has side effects. And it's also very effective at actually reversing symptoms of thinning. And so relatively recently, I just had this idea, what's happening in the airway? It is mucosal tissue. It is different than the vagina, however similar. And what if the exact same things are happening in the airway? And this is something that could be so easily treated, and women are suffering because of it. And it's not just sleep apnea. But voice changes, that's been well documented that women can't reach as high of notes after menopause, as well as chronic cough. So that is Estra Air, is developing a localized low dose estrogen to address menopausal drops in estrogen or lower hormone levels in the airway. And I should mention that there are not any studies really available that say why women are twice as likely to develop sleep apnea, which just blows my mind. It's an example of women's health that has been ignored by medicine. And it's not because it's not there, it's because there just haven't been studies and no one's had any interest in it. So I am about to change that.
That's awesome. Well, what an exciting time for you and for women that are suffering this. They're going to, hopefully find that it's happening, why it's happening, and a cure or a resolution to it. But that's awesome that you've seen it and that you're looking into it. So I think it will end up being a blessing to a lot of ladies.
Yes, that is the idea. And what's so cool about it is CPAPs treat it after it's already happened. And the goal here is prevention. And there aren't a lot of options for sleep apnea treatment. Ozempic basically, or the GLPs, they reduce body mass, which is indirectly supposed to help the airway. So this could be, as you said, really helpful to a lot of women.
That's awesome. So in the dental world, I mean, a lot of dentists coming out. It sound like you've had a lot of success in different spokes of the dental world. What's something that sets you apart from other dentists or other people trying to achieve some of the same thing?
Oh, that's a loaded question. I have to be a little careful here with my peers. It is interesting. My husband is a physician and I'm a dentist. And it was interesting, as I said, we both were in school at the same time in Oregon. And it was interesting looking at the two different classes. I mean, I shouldn't say classes, but his medical school class versus my dental school class, and just the patterns of learning. And I think that as far as what distinguishes me, I have always been fascinated by the why. And dentistry is very hands-on, and our focus in school was a little bit of the why, but a lot of hands-on. And I think I definitely stood out in my dental school class. Anybody watching this from my class is going to laugh because I was always the one saying, "But why is this happening?" Much to their annoyance, probably. But it's in my blood. I can't help it. I'm just always trying to find out at the root of what's going on, which is also leads to creative solutions. But it's definitely my thought process as far as and studying. I always studied alone because I drove everybody nuts because I was always saying, "Well, what about this? What about this?" and going off on all these tangents. So it was pretty exhausting.
And just you have the probably inquisitive mindset or just something where it's a neat asset or quality to have in someone to want to get deeper. And I could see I went to physical therapy school, and I know having that, like, no, you have some people that are like, let's just get through what we need to do and get to the next step. And then there's some of us that want to know more and dig deeper and learn. So that's great. You have that. It's I think going to be a great benefit to your current not customer patient base and your future, and then maybe people aren't your patients. You're setting up this study to learn more about women that are developing sleep apnea, premenopausal, postmenopausal, like how many people going forward that this could benefit is, just massive numbers. So I think it's awesome.
Well, I appreciate that. And it's so interesting. I sold my dental practice 5 months before COVID came to the US, the first case. And so I could focus on the Harmony appliance. And it's really been interesting shifting from having my own dental practice business to a startup of a different variety. It's a different nature. Starting a dental practice from scratch was a startup as well, but it was different. And it's really requires, especially since I work at home and I have all day and I can accomplish nothing or I can accomplish a lot of things,
Mm-hmm.
and which is a lot of people that work at home. But in my situation, I'm having to come up with everything I need to do to move the needle. And I am very efficient. I do not like to waste time. And so it's a constant, it's when I'm finished with my day, I'm pretty exhausted because again, my brain is saying, okay, well, let's try this. And then I realize 5 hours have passed and I've just been sitting at my desk the whole time, just going from one thing to the next. But it's been really fun. But it's to start a device from scratch does take a lot of self-motivated, inspired learning and inquisitiveness because you don't know what you're doing. And so you've got to figure it out.
That's awesome. Well, and drive, just, to be home. I work from home too. So yeah, if I let myself, I could do a lot of piddling during the day, but after the same way where I'm like, I've been at my desk since 7 this morning. I need to go outside for a little bit just to get some
Right.
sun on
Right.
my eyes or on my skin for a little bit. And so that having that motivation. Well, awesome. Well, have you come across anything that if any of our listeners want to get better at something like, trying to be more driven, or it sounds like you're naturally that way, or just improve in some way, have you come across anything that you could suggest to them? Podcasts, books, anything like
I
that.
Yes, sorry to cut you off. I absolutely love that question. I have two children and they're both very inquisitive. And what we talk about at home is if you see something that isn't working, uh, figure out a solution to fix it. I mean, start small. And it's amazing how much everything that's here has been invented by someone.
Mm-hmm.
And if you think about the inspiration that came and also need, discovering that this item could be really helpful and just to go about your life and using your eyes, looking around and being perceptive and thinking, how could this be easier? And the think outside the box metaphor is just so spot on because I feel like I live most of my life outside of the box. Um, which is unfortunate for my daughter because it's sometimes includes unique wardrobe choices too, or lack of unique wardrobe choices. But just taking each second of every day as an opportunity to look at things differently and think, how can I improve this? Because that's what I'm here to do.
No, great. What a great piece of advice. And I think that's sounds like what you've done. You saw something within your dental practice that, you know, said, "Hey," your curiosity said, "Why is this occurring? Why?" And you took off from there. So I think passing it on to your children and any listeners is just looking and seeing where there's a need and filling it is a great gift. So, what is one of the biggest challenges that you've had in your career path?
Probably to elaborate on not knowing what I'm doing, Harmony Appliance, starting that was difficult to figure out what I had to do, and then I had to go do it. Something that was really helpful to me, I was in a basically an accelerator, but it's an accelerator that focuses on helping women. It helps them with getting their businesses going, investment. It's called Springboard Enterprises. And if there's any female entrepreneur out there, I highly recommend them. They're out of New York City. And I was connected with amazing women that really took my Harmony Appliance business to the next level, for lack of other jargon. But they spent so much time with me. And I think what the take home there is that although I'd like to do everything myself because I don't like to impose on other people, the key here is getting help and surrounding yourself by exceptional people.
Mm.
And honestly, the exceptional people kind of formed their own group around me. And it's interesting because when I started the Harmony, I had to list advisors, and I didn't know anybody. I didn't know anybody. And now I have a bigger list than I could even, if I was to list off their names, I couldn't do it. Have such a network now, and I don't even know how it happened. But I think it was just more so uh, just following the impulses and the with each step and asking for help when I needed the help, and it just kind of happened. But really embracing that and the conversations and appreciating those people is so important too, and not taking it for granted.
Now, great stuff. And I think I hear that's a pretty common theme with people that I have on the podcast is leaning on others, having mentors or advisors to where, you don't want to necessarily, you don't want to be the smartest one in the room. You want to have others you want to be able to pour into them, but, learning from others too can go a long way and really help you accelerate. And I had a hard time with this and still challenging, not trying to do it all yourself because you can only be good at so many things, so you need to put some of that other stuff onto other people's plates to let them be good at what they do, and then you can really focus on the meat of what it is that you're doing, the main course or the main money maker, whatever that might be, is so important.
Yes, and something else that has been really critical to the progress that I've made in my companies are the people that have helped me, and I haven't had to pay them. And I don't even know how that happens, but I can name off a few that have given countless hours to helping me and have never once mentioned, I want you to pay me. They were helping me to, granted, I will hopefully have them on my, in my, I'll have places for them in my future or in the company. But just the trust and the kindness and the interest gives me hope in humanity.
Well, no, definitely, and I think a lot of that is the energy you put out too. I bet you're giving back to them that you're getting a lot of that same energy back, if that makes sense. That if you're a negative person, I think you're going to get negative, or if you're a greedy person, you're going to get greedy. So I think just in a little bit I've got to talk with you here for a few minutes, I just feel that positive energy and that you would want to help. So I bet that's where a lot of that's coming from. It's reciprocated how you're helping them, I bet.
It's so interesting. I rented this, and back when we had cassette tapes at the library, I rented a tape that was Penn and Teller. It was Penn, the guy with the long hair. And it was this 20-minute tape on schmoozing. And that might have been the best self-help I've ever listened to or gotten. Basically, the whole premise was just pay it forward. Everything that you do,
Mm-hmm.
kindness, talk to people, appreciate them, see them, acknowledge them. And if anybody can find his book that he wrote on audio tape, I recommend you get it because it was life-changing for me.
Well, that's neat. What popped in my head was the golden rule: just doing others as you want to have them do to you. So that's you know a lot of that it's true. It's just it's been around for a long time. Treat others how you want to be treated. So
Yep.
awesome. Well, Amy, it sounds like things are going very well for you, and it's a lot of people start having more and more success. They consider different type of outside investments outside of their company. Have you ever thought about doing any investing outside of what you're doing, like stocks or real estate, bonds, any different things like that?
My husband is a CMO at a medical clinic in Austin, and he is in charge of the retirement uh, strategy program at his clinic. And so he's working with other physicians and advising them on stocks and investments, which is kind of funny because we haven't done a whole lot of that. But don't tell anybody. Oops, this is a podcast. But he's become very well educated, and I get emails almost every day from Fidelity saying that there has been money transferred around, moved around. So I guess we are, as a family, investing in stocks, but I have nothing to do with it.
Husband does
So,
a little bit.
but as far as I know that my dad was a college professor, and for not making much money, he did very well with just mutual funds and investing early.
And that's we encourage in real estate, just something I think putting money where you're saving it and something that's growing. Well,
Yep.
that's awesome. Well, do you have you've got a lot of stuff on your plate. Do you have any exciting initiatives or plans that are real in the next 6 to 12 months that you can share with us?
Yes. So I am currently I have my patent pending for Estra Air, and this is really going to be my focus. I sold my dental practice, and Harmony Appliance is going to take a little bit of a back seat. I'm going to work on that after I get Estra Air launched. But in the next 6 months, we're going to be getting our advisory group with physicians, and I've been speaking to physicians at amazing people. I can't say who they are at this point, but assembling that team and then also getting ready for fundraising and then getting our final patent and also a proof of concept study done this year is our goal as well.
That's awesome. When you're in Austin, I don't know if you're working with any of the university. You just got a lot of research stuff probably going on there, and plus not too far from Houston where there's tons of medical research.
Yes.
So you're right in the middle of and even DFW, lots of stuff
Yep.
around. So
in Dallas, tons, and we're in such that's a good place here. I forget I'm part of the MedTech technology capital factory, all of that in Austin, but this is the fruit with the corridor they call it. But there's a lot of stuff in medicine and MedTech going on.
yeah,
I'm in a
that's
good
exciting.
place.
Well, an exciting time to be in the middle of that. Just everything's exploding. So thank you so much for taking time to share about you and what you're doing with our listeners. If people wanted to get in contact with you, what's the best way for them to do that or learn more about your products and your research?
Yes, well, they are welcome to email me. It's info@estrair, ESTRAIR. And I would love to talk to anyone, or if anybody's interested in Springboard Enterprises, if you are a woman founder, I would love to talk to you as well. Or any men too. I don't discriminate.
Awesome. Great stuff. Thank you so much. And everyone, thank you for listening. Be sure to like and share this podcast. And thank you for tuning in. Amy, thank you so much. I've really enjoyed getting to know you a little bit. Stay tight for a second.
Thank you.
Thanks for listening to the Flex Forward podcast. If you've got grit, growth, and a great story, visit flexforwardpodcast.com/guest to apply and join us on the show.